Deep in the heart of the Surrey countryside lies an extraordinary vet's practice.
Right, straight into number one. Good. All right, crack on. We're going to theatre. Let's go. All hands on deck.
Here, the hardest to treat pets from across Britain are given some of the most advanced procedures available anywhere in the country.
I got it. Various pieces fit together to build a new endoskeleton, a bit like the Terminator.
The practice is the brainchild of one man, Professor Noel Fitzpatrick.
Very fashionable, Cookie. That is beautiful.
Yes, yes!
Known as the Bionic vet, Noel has invented countless operations to help heal sick animals.
Some people come and they expect you to work a miracle.
Try and make it work.
But most people come full of hope.
No.
Come on, able to walk within 48 hours.
Yeah, well, people travel north, south, east and west and across the seas to us.
Distance is no object for people who want to have their pets treated at Fitzpatrick Referrals.
We've had people come from all over the UK.
We've had some from like Romania, Croatia, Portugal.
They are willing to travel hours, no matter how far they are.
It's very important to me that we give the same care to every patient, whether you come 5 miles or 500 miles or 5,000 miles.
They travel in real style, some of them.
We've got a long drive home today, about 640 miles. Oh, hello.
I'd do the same, definitely.
Noel's first patient today has come all the way from Switzerland.
Hi there. Okay, take a seat, okay.
Jürgen and his 10-year-old Chihuahua, Frincy, have driven through 6 countries to get here.
He is the best friend you can ever get. A day without him is a lost day. He is the best dog in the world.
Yeah, du der. Det var godt.
Recently, Frincy has developed a limp. His Swiss vet doesn't have a scanner to investigate further.
Yes, it's me.
So Jürgen's daughter, who lives in Surrey, suggested that he came to see Noel.
I will go to the moon and back again. I will do anything that is possible. My best friend should have the best treatment.
Hello, mate. Do you pronounce it Frins?
Fonse.
Frunze?
Yeah.
Does it mean anything special?
Yes, the small strings are on a Persian carpet, you know. The Danish name for fringe.
Frills, nice. All right, Frilly. Now then, when did this lameness happen?
This summer.
And what does it look like?
It had been a little...
So he's dipping his shoulder?
Yeah,
okay.
And then he refused to walk.
And just hold his head there. Come on, hold his bum, please. Thank you.
To find out why Frincy is lame,
Boy.
Noel needs to sedate him for X-rays and a CT scan.
All right. Okay, give him a big kiss.
Du bliv her. Bliv her. Fonse, jeg kommer og henter dig.
I'll see you later on. Take care.
As well as a limp, Noel has noticed another problem.
He salivated and coughed quite a lot when Dad left just then. So I'm just going to have a listen to his chest. This isn't good. He's got a heart murmur. Quite a bad heart murmur as well. That's not good. All right, just get Diego to have a look at that heart for me, please. Thank you.
Diego is an anaesthetist. He won't sedate Frincy if he thinks it will be too risky.
Heart is 150, it's quite high, but she's stressed. Hey, monkey.
Investigating his lameness will have to wait until Frincy has seen the cardiologist.
Good morning, Fitzpatrick Referrals, Orthopaedic and Neurology. How can I help?
As well as pre-planned appointments from far and wide, the practice also takes emergency referrals.
We're 24 hours, 7 days a week here.
Dog can't move and she wants it seen today.
We get emergencies all the time.
Hi guys, the cavalry have arrived.
They have to be carried in or stretchered in.
Some of the injuries that we get are pretty shocking.
If you're a surgeon, the patient always comes first.
1, 2, 3.
And that may be at the cost of your own personal life. And if you're not prepared for that, then it's not a vocation, it's just a job. It'll never be just a job for me.
Great, let's do it.
It's 8 o'clock on Sunday evening. Tim has brought in his 15-week-old golden retriever puppy.
Bring to prep and get everything ready.
Murphy was in a park when he was attacked by another dog, ripping apart his lower jaw.
We heard somebody shout, "Don't let him get to your dog." Within 1 second, he had jumped on Murphy. Something like it had happened before when dogs were playing in the park, and they realised that it was quite a lot more serious. He seemed to be locked on. Eventually, they let go. Murphy ran away. He was hiding under the chair and crying.
Tim, can you come in, please? Thanks. All right. Come on in. Sorry, man. I know that this is really tough. Clearly, it's very, very traumatic for him, what happened today. Our moral responsibility is to get him out of pain.
Yep.
Whatever that takes at this moment in time. So let me see what the extent of the damage is, and then I'll come and talk to you, and we'll see.
An initial examination reveals that Murphy's jawbone is badly damaged.
He has no permanent dentition. And his bone is like cheese. Let's get some rads and see what we're dealing with.
Murphy is Tim's first dog. He's only had him for 5 weeks.
Always wanted one. My mum's afraid of dogs, so we never had one growing up. I live with my sister, so he's great for the two of us. Made us very close, looking after him, because training him, he kind of loves hanging out with us all the time, which is great, but just changes your lifestyle completely.
Tim, can you come in, please? Right, I've had a look. The whole front of his face is ripped off from here down, and it's mush. I mean, it's literally mush.
What are the sort of options, what is the...
The options are we put him to sleep.
Yep. I'm sorry.
Or try and fix him, or try and amputate the front of his jaw. I'm not going to advise you to put him to sleep at this point, but what I am going to advise you to do is let me anesthetize him and let me see if there's any even theoretical way to put this back together.
Yeah, of course. Can I go and see him before you do it?
All right, come with me. Don't feel guilty for falling in love with him in a few weeks. I'll see what I can do. All right?
Thanks.
Okay. Well, everyone's in a state of shock, aren't they? It's just, it's a train has just hit your brain at that moment. You don't know what to do. You're just walking your dog in the park, and the next thing you've got blood pouring from everywhere and a complete disaster.
I think they're gonna put him dead. Really? I think we might have to let him go.
It's late on Sunday evening. Noel is examining 15-week-old retriever puppy Murphy after he was attacked by another dog.
Holy shit, I've never seen that in my entire life. The front of his jaw has been ripped off, but this bone still has a blood supply. Unbelievable. The only reason that's happened is he's a baby and the blood vessels and the nerves have stretched. I'm going to try and reconstruct it. I don't know if it's possible, but I'm gonna try.
Murphy's owner, Tim, is waiting for news.
Right, I've looked at it, and I should try, I think. I don't know if I can win. We have a molecule of a chance, but the bone is as soft as cheese. Right.
Noel will operate on Murphy tonight. Tim heads home to wait for news.
The bone is crushed in a load of different pieces. The inside of the mouth has all been ripped off.
Noel will need to wire Murphy's jaw back together.
I've got 3 problems. It's the perfect storm. It's in lots of pieces, very soft bone and quite hard teeth. Very difficult to drive pins in that. Come on, come on. Right, so I'm having a terrible time here. There's a pile of bone missing there, and there's a pile of bone missing there. I'm just having to bridge with those pins, because this tooth and other pieces of tissue have been ripped out.
To hold the wires in place, Noel attaches them to a rigid frame.
Keep the head up, please. Oh, man. Come on, give me a break here.
He hopes to correctly align the upper and lower jaws.
You can see that there isn't that much drift, because we've managed to put 2 pins through straight across there and 2 pins through straight across there, which means that the mandible doesn't rock. All right, thank you, everybody. Good boy.
As he is a puppy, Murphy's bones should heal quickly.
That was a really tough one.
But he's still at high risk of infection from the dog bite, and the holes in his jaw could pose a major problem.
Hello?
Tim.
No?
Yeah, he's okay.
Really?
He's okay.
Oh my God. Thank you so much.
It's all right. I don't know if he'll make it through totally, but I got it back in alignment.
We're so grateful.
I'm sorry you had to go through all of this, but hopefully he'll be okay in the end.
That's brilliant. Thank you.
Take care.
Bye.
Bye now. Bye.
The practice sees over 100 new patients every week, mostly dogs, of every age, size and breed.
Just said that the dog's on the phone, but the dog's not on the phone. Ruff, 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 ruff.
Today, Heather has brought in Mac, her 1-year-old Hungarian Vizsla.
Mac. So clumsy.
As a puppy, Mac was diagnosed with a bone and cartilage disorder in his knees.
It's the latter part of this year that he's got noticeably worse. As he's got older, he finds it harder and harder to sit. When he does fall over, he struggles to get up again. I don't want him to be in pain anymore, so I'm excited we'll get you fixed. Mac, come here, come on.
Okay, Mac, please.
Heather is hoping Noel will be able to advise her how best to help him.
So at 6 months, was he lame on both back legs or one?
No, just the one, just the left.
Just the left one, okay. He's really trying to put all his weight forward onto the front end.
He doesn't know which one to
Yeah,
stand
no,
on.
he doesn't. He's walking on eggshells.
Scans taken a year ago show that both Mac's knee joints have large holes in the bone.
The end of every bone has cartilage on it.
Yeah.
If it doesn't convert properly into bone, then it can flake off and you've got a big hole left. So you're having to do something.
Yeah. Oh yeah, we can't leave him to go on like he is, because he's clearly suffering. And he's not living the life that a Vizsla should live.
Before making a decision, Noel wants to investigate how bad Mac's knees have become.
Unfortunately, he already has severe arthritis. So we're just going to check inside Mac's knees using the arthroscope to determine just how bad the cartilage disease is. Okay, let's go. Turn off the surround lights.
But as Noel inserts the camera into the joint,
oh no,
he finds another problem.
Cruciate ligament rupture. That's probably 80% torn right there. The inflammation has occurred because there's a massive hole in the cartilage right there. The white stuff is cartilage, the red stuff is bone, and the bone is coming through, and that frondy stuff on the bottom, that's rupture cruciate. Oh man, that ligament's totally redundant.
Noel uses a special cutting tool to remove the torn ligaments and dead cartilage.
You see the blades on the lawnmower there as it eats the rest of that ligament away. It's like cutting through a rope. There he goes through the rope now. The key thing I have to determine is whether the meniscus is ruptured or not. That's the hook. I'm pulling on it now. The answer is no, it does not flip forwards. So we still have enough cartilage left there.
The other knee is not quite as bad. The hole in the femur isn't as big as Noel feared, so he just takes out the dead cartilage.
Let's get out of here.
It's good news. Mac still needs major surgery, but he won't need a total knee replacement.
Animal rescue.
Jürgen, who's come from Switzerland, is hoping Noel has found out why 10-year-old Frincy is lame.
Mr. Anderson?
But Noel and Diego have the difficult job of revealing what they've discovered.
Diego went to see the cardiologist today. There's a problem in the heart called endocardiosis, which is a type of disease that affects the valve.
How long has he had that?
Probably a few years. I mean, he has a very loud heart murmur. Okay, that's what called our attention.
We've got to ask the question morally and ethically about doing significant surgery on him.
But I love him very
What is in his best interest is what we want to advise you.
Yeah.
And we know you love him. So we want to advise you on a balance of risk.
Noel prescribes a course of tablets to try to get Frincy's heart disease under control.
There we go. Hi, Daddy. He loves his daddy, doesn't he?
He will only be able to start investigating Frincy's limp.
Thank you. Bye-bye.
If his heart function improves.
I'll do anything as long as he's not suffering. I've never had anything that was important to me in my whole life as he is. He's so loving, he's thankful. I'll do whatever have to be done for his sake.
Murphy, the puppy who was attacked by a dog in the park, is recovering under the close care of the nurses.
Yeah, Murphy's moving his jaw really, really well. He's actually managed to eat, and I think it's only about 12 hours after surgery, I think they said. Yeah, I think we're all a little bit in love, to say the least. So scrumptious. Everyone is absolutely smitten with him.
Today, Noel wants to check how well he's healing.
This side is doing okay. This side is not doing okay. He's got an obvious area of dead bone where it's been crushed by the dog bite.
Murphy will need another operation.
Okay, so I can't tell for sure what's alive or dead down there. If I take all that out down there, then there'll be nothing left to join up. But he's got a big gap here where there's no tissue. That's where the jaw was ripped off.
Noel covers the gaps by stitching the lining of the lip across them.
What I'm hoping is that some bone bridging will occur underneath, and if it does, then maybe it'll fill in enough.
Murphy will now be fed via a tube until his mouth has started to heal.
Good boy.
Heather has come to pick up Mac, her Hungarian Vizsla.
Hi, Heather.
Hello.
How are you doing? Come on in.
She's hoping Noel will have come up with a plan for him.
What I was looking for was how much damage had been caused by that hole in the femur. That's the hole in that bone.
Mm-hmm.
It's rubbing on this side, but it's not completely gone.
Right.
All right, so that's the answer we were looking for.
So that's a good thing.
That is a good thing, but it's still a very bad situation.
Yeah.
Mac also has torn cruciate ligaments, so the options are limited.
You have 3 choices.
Yep.
Choice number 1 is leave him as he is and just give him pills. Option number 2 is take out everything and put in a knee replacement. Now, there is an in-between option. You custom make a half a knee replacement. And that is possible in humans right now. But it's not in any textbook for dogs.
Okay.
That might last for life, but realize that in several years from now, whenever, you may or may not have to do a knee replacement.
Okay. Oh my God.
If Heather does decide Mac should have a partial knee replacement,
Lucky.
3D titanium and plastic implants will have to be made especially for him.
Come on then. It's just confusing knowing what to choose now, to just think about it all, think it all through. He's a member of the family, he's not just a dog.
It's another busy afternoon at the practice. And 6 weeks after his first visit to Noel, Jorgen has returned from Switzerland with his Chihuahua, Frinsy.
I'm nervous about today. I hope they can do something.
He's hoping that Frinsy's heart condition has improved enough so Noel can investigate his limp.
My concerns are 2 things. One, obviously there are concerns with the anesthetic.
I think I'm willing to take the risk with that because I would say if he dies, he has had a wonderful, free life.
The second thing is, you and I still don't know what the cause of his lameness is, whether it's treatable or not. Well, our job is to decide what's in his best welfare interests going forward.
Yep.
And then your mind will be at ease that you've done your best for your friend.
There you go.
After checking Frinsy's heart, Diego decides he is well enough to be sedated.
We'll be as gentle as we can, and we'll take it from there. You're such a monkey, eh? Yes, you are. Good. Perfect.
Now he can have an X-ray and CT scan to assess his joints.
So we have big problems. Frinsy is affected by shoulder arthritis and elbow arthritis, pretty bad on both sides. Okay, how's the heart going?
Heart's okay now, but he was quite hypotensive.
In a perfect world, I would operate on both elbows. I either do that now or I do it at a different time.
No, different time. I think it's a different day.
Frinsy will have to stay at the practice until he's strong enough to have another anaesthetic. Mac, the Hungarian Vizsla, is back at the practice after 8 weeks of restricted exercise.
I'm gonna get your leg fixed. Yes, we are. Yes, we are.
Heather has opted for a partial knee replacement to correct the damage caused by his bone and cartilage disorder.
Good job. Got your tail.
Today, she's brought her daughter Kira and her friend Katie to help entertain him before his operation.
He has so much fun with Katie. That's his favourite person. I get a bit jealous sometimes.
But I get the snobbiest.
But this is what it's been like constant since he's not been able to walk. And so I'm desperate to get the legs fixed so that we can wear him out again.
Matt, don't wait.
There we go. There's a nice rub. Last cuddle before you go in.
As well as having an implant fitted into his knee, Mac also needs surgery to deal with his ruptured cruciate ligaments.
Hi guys. I've considered quite deeply whether to do one knee or both knees at the same time. And my decision is if the first one goes well, then I don't see any harm in doing the second one. Okay, do you want to see the actual cap that I'm going to put into the hole?
Yeah, if we can, that'd be amazing.
And we've made this special plug exactly right for his knee, all based on his scan. And if you look very carefully, it's got a grey kind of powder on it. That powder makes the bone grow onto it, so it becomes part of his body forever and ever.
It's time to say goodbye.
Oh, have you drawn a picture? Oh, that's very nice. Good luck, Mac, and get well soon. Love from Kira, with lots of kisses. Of course, we can put that on his kennel. All right, buddy, give Mum a cuddle. All right, see you later. Come on.
You're gonna miss him.
Yeah.
I already do.
You already miss him? Oh,
No one will
Kira.
look after him.
He will. He will look after him. Totally excited that he might do both knees at the same time, but also nervous because that's a massive operation all at once and things can go wrong, and so yeah, nervous, worried for him.
Noel has performed over 3,500 cruciate knee surgeries.
It's going to be challenging getting at this.
But this will be the very first time he's ever used this particular custom-made implant to fill such a big hole in the femur.
As you can see, it's like a giant moon crater.
Noel has to centre the implant exactly right. A couple of millimetres out could shatter the joint surface.
That is a huge hole.
With potentially disastrous consequences.
I've got to be honest, as I was impacting that, I had cardiac palpitations, because for a moment there I thought I was going to split the femur. So this coating now completely resurfaces that side of the femur. This is super smooth. We should glide freely on the other surface for the rest of Mac's life.
Unexpectedly, Mac's right knee doesn't need an implant.
Since I did the arthroscopy at the hole, it's healed in with a scar, so that's pretty good. I'm going to leave that alone.
Noel also has to level off the tibias on both knees to address Mac's cruciate ligament ruptures. The operation on both knees has taken over 3 hours.
Looks good. And it should make his life a whole lot better within a month.
Hello.
Hey, Heather, I've done it. I decided to do both legs.
Wow, thank you so much.
He is going to wake up with his sore legs tomorrow, but I think overall, in 2 weeks' time, we'll be glad we did it.
Thank you so much.
Pleasure.
Yeah.
All right, night-night. Bye-bye. Bye.
Guys, there's an emergency!
Murphy's been at the practice for 4 days now, and he's likely to be in for at least another week. Tim and his sister Gillian are allowed to visit.
Hello, little man.
Hello. Hello, everybody. There we go.
Fragile, is he?
Not fragile at all. As you can see, he's his normal self.
Oh, hello, little man.
Doesn't he look
Hello.
good?
Yeah, he looks great.
Take your time. All right?
Thanks a lot.
Take your time, and I'll be back. I'll be back to see you in 10.
You still looking for trouble?
I'm on to you. I'm on to you. I'm just so relieved. I've been, I've just been so worried. I'm still worried, but it feels a lot better seeing him.
And he's still wanting to investigate everything that goes on.
Look at those eyes. Look at you.
No doubt been Everybody's falling in love with them here, I'm sure.
All too soon, visiting time is over.
All right then, big kiss. There we go, no problem. All right, bye-bye, Mum, bye-bye, Dad. I'm going with Uncle Noel again. We're going to have fun.
Hopefully he'll be home soon. And
Yeah, the house just feels really empty. It's just, there's something missing. It's like a vacuum.
It's late afternoon.
Such a sweet dog.
Frincy, the 10-year-old Chihuahua, is about to have surgery to ease his arthritic elbows.
Good boy.
He has a weak heart, so Diego will monitor him carefully throughout the operation.
Anesthetic stable? I will be as quick as I possibly can, my friend.
Noel removes fragments of bone and cartilage from the joint.
Okay, hit it. Harder. Okay, so that's the big fragment out. I'm just going to take some tiny bits out now with a smaller forceps.
After cutting one of the tendons to reduce rubbing in the joint, Noel has another trick up his sleeve.
These are 2 injections. One is lubrication plus an anti-inflammatory, and this is an anti-inflammatory steroid. Okay. Is everything all right in the anesthetic?
Yeah.
After cleaning up the other elbow, he also injects anti-inflammatory lubricant into Frince's shoulder joints.
Okay, our work here is done. Wake up.
Frankie, wakey. No sleepiness. No sleepiness now. Wakey. Oh, that's good. Oh, that's good. You want the kisses? You want to go home? Come home.
Frincy will be closely monitored overnight.
Hello.
Hello, Jorgen. It's Noel here. Okay, so
How did it go?
It went fine.
How did they react being left with you?
Oh, he's been fine. He's been getting lots of cuddles and lots of attention. In fact, I was thinking of keeping some of his hair and putting it on my shoulders so that the nurses might show me more attention. Okay.
Thank you very much. Thank you.
See you later.
Bye-bye.
Bye. Bye.
Frincy, Mikey. Oi.
The next day, Diego checks Frincy to see if he is well enough to go home.
He was fine overnight, so he's probably missing his daddy. Hopefully back to normal in a couple of days.
Jorgen has come to collect him.
It's wonderful to have him back. I was licked and licked and licked and licked.
Frincy will go back to Switzerland to rest.
Yeah, keep going that way. That's it. Good boy, Mr. Mac. Keep going.
Only 3 days after major surgery, Mac is making good progress.
That's great. So Mac's knees are moving pretty good. Great, girls. Just take him for a little walk. He's doing fantastic today, which is great, but we can't count our chickens yet.
A few days later, he's well enough to go home.
Here he comes.
Heather and her husband Steve will need to keep him on cage rest for the next few weeks. Any sudden jolting could cause the implant or the plates and screws in his knees to fail.
I'm just going to cuddle him, bring the futon down, and he'll sleep with me. Thank you. Sorry, I do love you as well.
I'm fully aware I'm going to be taking a back seat for the next 6 weeks.
Murphy has been at the practice for over a week now.
Come on then.
Noel is checking him every day.
Wait. We've got some, yeah. There's a dead piece of bone right there. That means there must be some infection in here injected by the dog bite.
A bad infection could limit Murphy's chance of recovery.
There's some pus right down at the base of the hole. Give me another swab. There's some pus in here. We just got to somehow get rid of this infection and somehow get the bone to stabilize. So this is an antiseptic spray. This is going to need to be put in 3 times a day. Right, so that's very disappointing for Murphy.
Until the infection clears, Murphy will need to stay at the practice. In Dunstable, Mac is recovering from the operation on his knees.
First 2 weeks, he just wanted to sleep and rest. The last few weeks, he's obviously feeling a bit better and therefore becoming a little bit more boisterous, frustrated and grumpy looking. Okay, come on then, Mac.
To stop him getting bored, Heather and Kira have come up with some games.
Where are the sausages? No, don't tip it over. Where are they? You've got one. Good boy. He's just gannet. He's mad for food. Should we do the other one? Yeah. Should we do the bottles? Yeah. Very high tech. Go on, Mac. Where's the sausage? He's got a good sense of smell because he's got such a big nose. Yes. Mac. Good boy.
Mac is allowed to go for short walks on the lead.
Here we go. Okay.
But as he recovers, he's becoming more difficult to keep under control. He's only halfway through his recovery.
Mac, can you stop pulling me?
He won't be allowed off his lead until he's signed off at 12 weeks.
It's hard work, isn't it?
Come on, there's a good boy.
Most of the pets operated on at the practice are able to go home within a few days. Those who have more complicated surgeries or need specialist care have to stay for longer. Murphy, the golden retriever puppy,
That's it, good boy.
has now been at the practice for nearly 3 weeks.
Oh, you need to give the best hugs. Oh, my feet.
For staff, it can be hard to say goodbye.
Murphy.
If a patient's been in for more than a couple of weeks, I'm like, oh, I love them, they're my favourite. When they go home, you're really pleased, but you also are really sad because you know you're not going to see them the next day.
Now Murphy is free from infection, Noel is letting Tin take him home.
Hello, little man. Hello.
Hey, mate, how are you?
Hello.
Come here, let me look. It's all right, buddy. Let me look. So we can see in there where I've stitched in the gum lining to fill the hole, and it looks much better than it did before now. He's definitely back on track now. We're seeing massive progress.
It'll be great to have him home. I mean, I think he'll be excited when he gets in. I think he'll be happy to smell everything again. That's gonna be good. I think my sister will be very excited. Don't think she's gonna work for too much longer today.
Murphy will be back in 3 weeks to find out if he can have his frame removed. In reception, there's a familiar figure. Jürgen has made the long journey back to Surrey from Switzerland. 6 weeks after surgery, Fritz's arthritis is still bothering him.
He has some pain still in the shoulder and he's walking a funny way with his leg. I hope something can be done. I hope he can get it better.
10-year-old Fritz has improved, but he's still limping.
Good boy. Subjectively, from my perspective, I don't think he's in as much pain as he was when I first saw him. We definitely don't want to put him through more surgery. So I'm going to prescribe for you some tablets.
Yep.
That you're going to give alongside those you already have.
Yep.
So there is hope, but remember, the gift we give to you is the length of his life. The gift we give to him is the quality of his life.
Yep. I can't stand if he is pain.
No, I understand. We understand that. Oh, the poor fella. Poor fella. It's just tears welling up in his eyes there. He would rather that we put him to sleep, have him in pain. But he doesn't want to say goodbye to his friend.
The new tablets should help ease Fritz's pain.
I have never had from any so unconditional love he gives. You can't buy it. I'm lucky to have him. Can you give me a kiss? Can you?
A week later, Jorgen and his friend Kirsten bring Fritzy back so Noel can check if his new medication is working.
Come here. Yeah.
Looks certainly more sprightly than last time.
Yeah.
Fritzy's mobility has improved.
He's physically looking happier in himself. He's got a bit of a bounce in his step, and he's at least smiling. He's got his ears up. Ultimately, you know we can't cure him anyway, but we can hopefully keep him happy for as long as is possible.
Yeah.
Let me have a cuddle. All right, Bubs. Front.
Yeah.
Right, good boy. Off you go.
Thank you very much.
Yourself.
Take care.
Bye-bye, Franz.
Bye-bye.
Take care. God bless. Bye-bye. Bye-bye.
With further surgery ruled out, the only option is to keep Fritzy comfortable in his old age.
I don't think we need to put him to sleep at this moment, but I think that point will come in the not too distant future.
Franz?
Mac Dunn, please. Hello, Mackie. We're going outside, Heather.
It's 3 months since Noel operated on Mac's knees. The bone has grown onto the implant and the plate and screws are all secure.
How is he?
Yeah, he's doing really
Hey, mate. Hi. It's good to see you, bud. Good to see you.
Heather has brought him in for his 12-week checkup.
That's tons better. Those legs are bearing weight now evenly. Good boy. You the man, Mac. That's my camera. You can leave that alone. Good boy, Mac. Well done. Just hold his head there for me. Really good. All right, that's a normal range of flexion. That's really heartening. Well done, mate. You're looking great. You can go off lead.
Can he?
Yep.
Yay!
Good
Oh
boy.
my God, I'm so pleased.
And 1, 2, 3, off we go.
Where are you going to go? Where are you going to go?
Good boy, Mac. Come on, come and say hi. Hey.
Oh.
Hey, good boy.
Oh, Mac.
Yeah.
Oh, look at you.
That's awesome.
You're running.
That's really great. From a dog that was in pain every day to a dog that's running around the field happy as Larry, that's very encouraging. From my perspective right now, he's signed off.
Yeah, he needs to learn how to stop now.
Yeah, he's like, this is the best day of my life.
Feeling very happy because he's fixed. Totally worth it. Yes.
Today is a big day for Murphy, the golden retriever puppy. Noel is hoping he'll be able to remove the frame from his jaw. Scans will determine if his fractured bone has healed.
That looks pretty good. Very important that the bite is correct, otherwise if it was awful like that, the teeth will be sticking in the gums. Let's have a look at a CT. Look at that. That is absolutely fantastic. Look at that. Solid bone right through. It's healed right across. That's tremendous. I think that frame can come off.
A physical exam confirms the good news.
That feels pretty solid. And on this side, it's rock solid. Clippers. It just goes to show, you should never give up, you know? You should never give up on life when there's a reasonable chance of saving it. And this is just a puppy with a whole life ahead of him. Alrighty, I'm about to cut the last pin now. Here we go. Good boy, Murphy. Oh, man. I'm more excited about this than I think I've been about any operation in the last year. It's amazing. Thanks, everyone. Fantastic day. Good boy, Murph.
2 months after the attack, Murphy is back, running around the park.
He's loving being back playing with all the other dogs. I'm just worried how he'd react the first time a dog came up to him or ran at him fast. And he's been fine. Everybody's quite protective of him here. Everybody's been keeping an eye on him and looking out for him the whole time. And yeah, a bit of a mini celebrity, I think. He's great, like, I love him, so to get him back like this, kind of, it's incredible. You know, being buddies for 15 more years, hopefully. And that's all I'm really ever wanted and all I'm looking forward to.